Hello, my name is Hannah Manella, and I am a registered dietitian at Rush University Medical Center. I'm here today just to talk about chronic disease prevention and specifically looking at different types of healthy lifestyle behaviors that individuals can implement in hopes of decreasing their risk of developing certain types of chronic diseases. First, by starting off, over 1/2 of all American adults have more than one preventable chronic condition, and nearly 1/4 of individuals in the United States have more than 2 chronic conditions. And the presence of these conditions do require ongoing medical attention and may be associated with decreased activities of daily living and quality of life. Many of these chronic diseases are actually preventable. The leading preventable chronic disease in the United States consists of heart disease and stroke, cancer, type 2 diabetes, and various respiratory diseases such as COPD. There are a variety of risk factors that have been associated with the development of these diseases, and the leading ones in research have been found to be lack of physical activity, poor nutritional behaviors, tobacco use, or excessive alcohol intake. Here are a number of the various risk factors that I will review today during this presentation. I'll go into more detail in the upcoming slides. High blood pressure is the first one I'm going to start with today. So high blood pressure has been associated with various chronic diseases, and high blood pressure is considered systolic blood pressure over 130 millimeters of mercury, or a diastolic blood pressure of over 80 millimeters per mercury. The associated chronic diseases with high blood pressure consist of heart disease and stroke. There are a variety of different lifestyle recommendations that have been proposed to assist with blood pressure management. First and foremost, a well-balanced low-sodium diet has been found to impact blood pressure, specifically for individuals who are sodium sensitive. We know salt contains a large quantity of sodium, so as a result, they do encourage individuals to limit total sodium or salt consumption. And they encourage individuals to limit salt to less than 2,300 milligrams of sodium per day, which comes out to 1 teaspoon of salt. So they do encourage individuals to aim for less than 1 teaspoon of salt, but it is found in a majority of foods as well. Limiting alcohol intake. Alcohol has been associated with increases in blood pressure after consumption. Maintaining regular physical activity level. I'll go into this further on as well too, but the goal of 150 minutes of moderate intensity activity per week has been shown to make positive impacts on blood pressure status. Maintaining a healthy weight has been found beneficial, as well as quitting smoking. Smoking has a direct effect on blood vessels, and specifically the dilation and constriction of blood vessels, and by quitting smoking you can actually see improvements in blood pressure levels. The next risk factor I'm going to discuss is tobacco use, and tobacco is recognized as the largest preventable cause of death in the United States, and there are over 480,000 deaths per year associated with tobacco use. Tobacco use is a risk factor for all of the 5 listed preventable chronic diseases I have here. It adds in that 5th component of respiratory diseases. We do know that quitting smoking or quitting tobacco is very difficult given the addictive nature of the substance. And we know that it can be difficult because individuals have withdrawal symptoms. It does cause a stress response, and individuals often do gain a significant amount of weight after quitting tobacco use. A lot of people end up overeating in response to the cravings associated with the withdrawal symptoms. However, quitting smoking or quitting tobacco use in general has been shown to reduce the risk of various cancers, heart disease, and stroke within 6 months to 1 year following cessation. The third risk factor we're going to discuss is obesity. Obesity epidemic in our country continues to grow, and currently almost 40% of all Americans are considered obese. There are a variety of ways to determine what obesity is. Commonly, the body mass index is being used as a screening measure for obesity. We know that body mass index is imperfect, however, because it does not take into account age, muscle mass, fat mass, gender. However, it has been shown to be a fairly decent representation of adiposity, specifically once you do get into the higher body mass categories such as obesity or morbid obesity. You can use circumference measurements as well too and look at those in a variety of different ways. You can look at skin fold thickness too, and you use a caliper to differentiate the total quantity of fat and muscle in a certain area on your body, specifically looking at, say, the tricep area. You can differentiate between fat and muscle in those measurements, but those very much so are assessment limited. So say if an individual that is assessing the skin fold isn't as familiar, it might not be as accurate of an assessment. And also bioelectrical impedance is a assessment where they run currents through your body and they're able to differentiate between muscle and fat stores. So these are all different tools to be used, but primarily being used is body mass index. You know, obesity has been associated with contributing to a majority of the preventable chronic diseases, limiting respiratory disease from the equation, but obesity has been associated with heart disease, stroke, cancer. Specifically with cancers, it's been associated with increased risk of breast cancer, endometrial cancer, colon cancer, kidney cancer, gallbladder cancer, and liver cancer. But it is a complex issue. It cannot just be solved at one time. You have to approach a variety of different factors in order to truly impact this risk factor. So it has to start on a behavioral level. So maybe undesirable food choices are happening, maybe physical inactivity, maybe it could even be medication use. There are certain medications that are associated with weight gain, such as steroids or antidepressants. Even approaching the environment. So what type of community are individuals living in? Is a community with low access to grocery stores? Maybe they're utilizing more convenience stores for their food items, which oftentimes are more shelf-stable, higher calorie items at those times. And we do also know that genetics play a role in obesity, and they could even be linked to hunger cues or even food intake, just on a genetics. However, we do know that obesity is multifactorial and it results in complex interactions. So we do encourage individuals to adopt a healthy eating and physical activity habits just because you can't change your genes. So you do want to make sure that you are putting yourself at the best chance of combating these obesity genetics as much as possible. Physical activity or physical inactivity is the next risk factor, and it has been shown that nearly 50% of American adults do not meet the guidelines for physical activity. And what are the guidelines? The 2010 Physical Activity Guidelines suggest all American adults should engage in 150 minutes of moderate intensity activity per week. What is moderate intensity activity? That can vary from person to person, but typically we recognize it as those activities, walking a dog or gardening, hiking at a light level, doubles tennis, or maybe even ballroom dancing. So these light activities that you can still hold a conversation while doing are considered moderate intensity. Vigorous intensity, these are going to be those activities that are challenging in nature. You have a difficult time speaking during the activity because your heart rate is up, you're breathing heavy, you're going to have a difficult time talking during these types of activities. And the physical activity guidelines encourage individuals to engage in 75 minutes a week of these activities if this is the level of activity you're able to participate in. This could include running, swimming, jump roping, dancing, in a lot other in addition to that, but those are some examples. If you were to break, say, the 150 minutes of moderate intensity activity down, it would come out to 30 minutes, 5 days a week of moderate intensity activity, However, we do recognize that some activity is better than none at the end of the day, and this activity can be broken up into 10-minute intervals. Say if someone is starting off on a new exercise program, they want to start walking, however, they're not able to walk for more than 15 minutes at a time, that is okay. Then maybe that just means that activity needs to be broken in to smaller time frames in order to meet those 30 minutes 5 days a week. And really at the end of the day, the focus is on reducing sedentary time, reducing the time that you're sitting. So many studies have shown that people that are even unable just to sit for prolonged periods of time, say they get antsy and they need to get up and walk around, those people have been shown to burn more calories just in those light activities, getting up and limiting the amount of time they're sitting than just being sedentary. However, I do need to note that if an individual is starting a new exercise program, please seek medical clearance prior to doing so. And then one of the last ones is nutrition. And of course, as a dietitian, I will spend a little more time in this section just because it has been linked to a number of chronic diseases, and nutrition in general has been linked to the obesity epidemic as well as blood pressure and various other risk factors as well too. So I do believe they all come in full circle. And it has been found that undesirable food choices and excess alcohol intake has been associated with a number of chronic diseases, looking at heart disease, stroke, cancer, and type 2 diabetes specifically. 3/4 of our population has inadequate intakes of vegetables, fruits, dairies, and healthy oils, heart-healthy oils, which I can go more into later down. And over half of the population is exceeding the total grain and protein recommendations, and specifically choosing the undesirable grains and proteins in these categories. So rather than choosing whole grain options, individuals are choosing more refined options. And rather than choosing lean proteins, they're choosing more high-fat meats, and which are not fitting within the recommendations. And I'll go into more of the recommendations on the next slide. And then in addition, most Americans do exceed the recommendations for added sugar, saturated fat, which is that fat that's solid at room temperature that has been associated with increased cholesterol levels, and as well as sodium. And we do know that excess sodium can be associated with increasing blood pressure levels. However, there's many styles of eating that have been found to be beneficial. Many studies link different eating habits or different dietary patterns are beneficial, but where do we start? Which one is to choose and which one is the best for you? I'm going to be going through 3 different diet recommendations. However, there are many, many more options. These are just typically the largest ones that you will see recommended. The first one I'm going to start by talking about is the Dietary Guidelines for Americans. So these recommendations reflect the current research or the current nutritional science evidence that promotes health, prevents chronic diseases, and helps people reach and maintain weight. So it's looking at the research that's out there and coming up with some recommendations based on previous studies that have been done. There are 3 main recommendations for this study. However, it goes into more detail per recommendation. I believe it's about a 56-page document, so it's very intensive. So I encourage you to look at the recommendations and see more details associated with it. The first recommendation, consume a healthy eating pattern that includes all foods and beverages within an appropriate calorie level. So it's not necessarily going to say you cannot eat this, you cannot drink this, never have this, but taking a step back and recognizing, oh, maybe 4 cans of soda a day may exceed my appropriate calorie level. Given a can of soda could contain anywhere from 250 to 300 calories, so it may exceed your appropriate calorie level. So taking a step back and seeing if it can fit into your recommendations. A healthy eating pattern includes a variety of vegetables in all colors. Fruits, especially whole fruits, trying to avoid any type of canned fruits given they are often associated with increased added sugar. Grains, and making half of those grains that you're choosing whole grains. Trying to choose low-fat or fat-free dairy products rather than high-fat dairy products. And then choosing a variety of protein sources, ideally choosing lean protein sources such as seafood, lean meats, poultry, but also being able to incorporate a variety of other products such as legumes, nuts, seeds, and soy products as well too. And then a healthy eating pattern limits, does not avoid it, limits saturated fat, trans fat, added sugar, and sodium. So to choose these items in a lower quantity, just to make sure it's not the primary focus of your diet, but you do want to focus on cutting back on saturated fats, trans fats, sugar, and salt. The second diet recommendation I'm going to review is the Harvard's Healthy Eating Plate and the MyPlate. I do lump these together because they are fairly similar. However, they have some slight differentiations. So what these do is they illustrate the food groups included in a healthy diet. They give you a visual of a healthy eating behavior from a plate perspective. Typically in practice, I find as though these plate methods are most applicable at lunch or dinner times versus breakfast, because it can be hard if you do eat a traditional breakfast style meal to incorporate these food groups in. However, with these styles, the food groups that are included for both of the styles are fruits, vegetables, grains, and proteins. Right? If you were to go to look at the healthy eating plate, it's a little difficult right now to see because the screen is small, but it does break down details for each of these sections. So specifically looking at the vegetables, it encourages a variety of vegetables, trying to focus more so on vegetables and limiting those high starchy vegetables like potatoes. And the MyPlate does not break these down, but MyPlate, if you do go online to choose myplate.gov, it does provide these recommendations as well too. Another recommendation or another thing to keep in mind with the differences between these plates is that the Harvard Healthy Eating Plate does not include dairy on their plate. They do encourage individuals to consume 2 servings of dairy a day, but they do not believe that it has to be done at every single meal. They do encourage adequate water intake for hydration purposes. And the Harvard plate also includes oils in this category, and they include those heart-healthy mono and polyunsaturated fats, so those liquids that are those oils that are liquid at room temperature, such as olive oil, canola oil, and those various oils. They encourage to use those versus those saturated fat alternatives such as butter or margarine or lard. And the last diet recommendation I'm going to discuss is the dietary approaches to stop hypertension. So this is the DASH diet. This is the diet that's been most associated with decreasing the risk of hypertension. So this is the hypertension-focused diet. It's been able to have a lot of really good findings and reports on improvements in blood pressure results. It aims to create a heart-healthy eating style for life. It's not a temporary diet. It is an eating behavior for your life. It does not limit certain foods. So similar to the dietary guidelines for Americans, it doesn't say you can or you can't eat certain foods. However, it even breaks it down further than that, because it just essentially provides daily and weekly nutritional goals. So it doesn't say you need to eat this many servings or you don't need to eat this quantity. It's just saying you try to meet it within your weekly and daily goals. So this is a breakdown of how this diet works. So you have the food and nutrient groups on the left. So you have your grains, your meat and poultry, your vegetables, your fruit, your dairy, your fats, your sodium, nuts and seeds, beans and sweets. And then on the right-hand side, it recommends the servings to try to aim for per day. So with the grains, they want you to try to aim for 6 to 8 servings of grains per day. And ideally, they would encourage you to try to choose whole grains when possible. For meats, poultry, and fish, 6 or less servings per day. So, and another thing to keep in mind, a serving size of meat is 3 ounces. So that's significantly smaller than the serving size that we would normally eat in a day. So that 6, yes, may seem like a lot, but typically we eat about 2 servings per meal anyway. Vegetables, 4 to 5 servings per meal. Fruit, 4 to 5 servings. Low-fat dairy, 4 to 5 servings. Fats and oils, and so on and so forth. Nuts, seeds, beans, as well as sweets, they do have a recommendation based on your week. So they want you to try to aim for 4 to 5 servings of nuts, seeds, and beans per week, and 5 or less servings of sweets per week. Okay, so there's a lot of information from those diets, but in summary, what all of these diets have in common include fruits, vegetables, beans and legumes, nuts and seeds, different types of lean proteins such as fish, poultry, or plant-based proteins such as soy, and include low-fat dairy products and heart-healthy fats. At the end of the day, those are the foods to try to focus on. Limit added sugar, such as sweets or sugary drinks. Sodium, which is found in fatty or processed meats or high-salt foods. And then saturated fat, which is also found in fatty meats, marbled meats, high-fat cheeses, things like that as well too. And then trying to avoid trans fats. Trans fats are associated with increasing bad cholesterol, or that LDL cholesterol, as well as partially hydrogenated oils, which are a component of trans fats. Typically, these foods are found in fried items. A lot of frying oils are actually made from trans fats because they have a higher shelf life. And a lot of pastry products that are made with large shortening and those things may be higher in trans fat as well too. Alcohol use is the next risk factor I will talk about, and high intakes of alcohol are associated with over 200 different types of diseases, but specifically looking at the diseases we are talking about here, it's associated with increased risk of heart disease, stroke, cancer, and type 2 diabetes. What do individuals need to aim for with alcohol intake though? A low to moderate alcohol consumption is considered 1 to 2 drinks a day. High intakes are considered over 2 drinks per day, and binge drinking is considered over 5 drinks in one sitting. Overall, recommended for men to limit alcohol intake to less than 2 drinks per day, and for women, that's less than 1 drink per day. So when you're breaking it down into specific beverages, say 1 12-ounce beer is going to be 1 drink a day. 1 4-ounce glass of wine is 1 drink a day. So looking at it in that perspective, that they are in different quantities based on alcohol intake, but overall trying to focus on less than 2 drinks a day per men and less than 1 drink a day per woman to decrease your risk of developing these chronic diseases. And last but not least, sunscreen use. We do know that inadequate sunscreen use and excessive sun exposure is linked to the development of skin cancer. And sunscreen has been shown to protect the skin from sun's harmful UV rays. Overall, currently, 1 in 5 Americans will develop skin cancer in their lifetime, so it is very important to make sure that you are adequately applying sunscreen and choosing the right kind when doing so. So choosing a broad spectrum protection, one that protects against both UVA and UVB rays, as well as choosing an SPF 30 or higher. Also, it's very beneficial to look for a water-resistant brand, given the increased rate of sweating in the warmer summer months, as well as possible water exposure if you're swimming or anything like that. In summary, I know I went through a lot of information in a short amount of time, but 1/2 of American adults have at least one chronic condition, and many of these conditions are preventable. Common risk factors include high blood pressure, tobacco use, physical inactivity, obesity, excessive alcohol, low fruits and vegetables, high sodium and saturated fat, as well as poor sun safety. Here are my resources, and thank you for listening.